Okay, ready?
All right, go ahead.
Hi, you're listening to Daniel Ronel, Talk 1260 KTRC. We're on Western Medicine, the show about plastic surgery. The byline is the Humanity Behind the Vanity. And we're talking about the reality of things. Today I have a great guest, one of my favorite anesthesiologists from the Physicians Plaza Surgery Center, Dr. Les Garson. And we're going to talk about the realities of anesthesia. So, hi Les.
Hi Dan, hi. Thanks for having me here. It's a pleasure.
It's my pleasure. I get a lot of questions from patients asking me about anesthesia. They say they're worried. They think they're going to die. You know, and I tell them, come on, the most dangerous part about the surgery is actually driving there, especially in New Mexico.
Well, that's a great point you make to your patients, Dan. Anesthesia today in the year 2009 is extremely safe. Statistically speaking, current statistics show that the morbidity, mortality rates of an event occurring under anesthesia are about 1 in 200,000. Referring to those statistics, the chances of being in a car accident are actually about 1 in 20,000.
Oh, really?
And we get into our cars every day, many times a day.
Right.
So clearly, your chances of having a bad thing happen, an adverse event occur while driving your car are much, much higher than anything occurring under an anesthetic.
Yeah, okay. Well, I mean, that's reassuring, and that's what I impart to people. You know, they're choosing to have their surgery. It's not like their appendix is about to burst, and so they're always wondering about their children, and are they going to survive? And I say, you go to the grocery store all the time. That's more dangerous than this. You know, trying to put it into context. What are some of the other things people are worried about with anesthesia?
Well, one of the things we get asked almost every day, very often, is, am I going to wake up while I'm out, while I'm under an anesthetic?
Right.
And
see that on TV all the time.
Yes, and that's a very, very common question, and it's actually, even though there is a lot of media coverage of that kind of thing, it's actually a fairly rare and infrequent.
It never happens to me.
I've never seen it though on these shows. I've never seen someone wake up.
Oh, I've seen it like on the show. Yeah, when some big guy sits up in the middle and rips out his IVs.
Oh, I think they're barely under. Those are those wacky Life in the ER or whatever that is. I'm talking about plastic surgery, which is a controlled setting.
Yeah, it's never happened to me.
Right.
And I mean, you do hear about some people who say, you know, I heard you speaking, and who knows what that is. That means
oh yeah, when I had my nose done, I heard the anesthesiologist and the plastic surgeon saying, "Can you believe this, Dr. Drapkin's daughter let her run around like this all her life?" Because I had a huge bump on my nose from breaking it twice. When I was coming out, I heard that, but it was over. You know?
Right.
Yeah, it's really very uncommon. We have all kinds of monitors that we use routinely on every patient who undergoes an anesthetic that would alert us, the anesthesiologists, to something going on, and certainly if the patient were starting to awaken or have some kind of awareness.
You know about it way ahead of time.
Right.
Yeah, right.
Okay, wait, Dr. Garson, here's my big question as a patient and one, thanks for trying to talk about it, and one who has, you know, had multiple surgeries and maybe twice has woken up. You have never done it. You have never been my anesthesiologist, so you're in the clear. But twice I've woken up queasy. That's my biggest fear, is throwing up. It's my biggest fear. And so that's the question. The first question, I nail all of you with it. Anybody who's in my room, I don't want to throw up. I don't want to throw up. Make sure I don't throw up. Make sure I'm not sick when I wake up. Blah, blah, blah. Okay, that's my biggest fear. Okay.
Again, a common concern from patients, and again, fortunately, we have a tremendous armamentarium of pharmaceutical agents that we can use to help prevent nausea and vomiting on patients who awaken after an anesthetic. Additionally, if for some chance or some unlucky reason you happen to feel a little queasy in the recovery room, we have even more medications that we can give there to help prevent that.
Great. And one of the things I do with the integrative team is preoperative acupuncture has been proven in a double-blind, placebo-controlled trial to decrease postoperative nausea and pain.
I'm doing it next time.
Okay, fine.
Perfect. Is that P6?
Yeah.
Okay, excellent.
Yes, I mean,
what's
we use
P6?
It's one of the
acupuncture.
Oh, okay.
Yeah, one of the sites. And, you know, we use acupuncture and other things to help that from happening, and I really see a difference in my patients. They just really, a lot of them sail through the surgery. So
can you do that for motion sickness too? Same thing, same point?
Yes.
Okay.
yes, you can. All right, so you're listening to Western Medicine, Dr. Daniel Ronel, speaking with Dr. Les Garson and Betsy Ronel about the realities behind plastic surgery. This is Talk 1260 KTRC. Thank you.
Thank you, Dr. Garson.
Thank you.